if I'm not wrong, but I'll allow him to introduce himself and his initiative as well before we get into this whole conversation. Welcome to the show.
Okay, thank you so much.
Right.
My name is Isaac Ogutu. I'm a fourth year medical laboratory student from the School of Health Sciences. Just like you've been told by my host here, I have an initiative I founded in the year 2020 during the COVID-19 season era. So I thought about it, how people are being in quarantine. There's a bit of lockdowns. People are really suffering indoors. There's a lot of mental health issues and so on. And again, because there was lockdown and people are not getting out unless you are designated to do so, there were a lot of physical inactivity. So these physical inactivities all over time, they led to a lot of health issues. So me coming with Afya Fitness 20, people are desperate, like they don't know what will happen with Corona the next moment or the next minute. So I was there to give them health education. You should be doing this, you should wash your hands, you should take lemon water because COVID-19 is a virus, and a virus are very susceptible to I can say detergents or solutions that have low pH and so on, like the lemon has an acid. So while I was interacting with people on those health issues, I think the idea came about Afya Fitness 20. Now, Afya is a Swahili word to mean health, and the fitness part of it is to mean okay,
right.
Physically fit, mentally fit, health, spiritually fit, and so on. So 20 part of it is the year that it was formed. Now, healthcare, there are components of healthcare that includes preventive, curative, and diagnosis. So whatever I'm doing is preventive. I want people to prevent. Prevention is better than cure. They say so.
Right.
So, and then initiative. In this case, we are working to ensure that people get sensitized, people get an awareness, and people get that bit of information. Perhaps they cannot receive on other end, or if they receive on other end, they have to pay.
Right.
Yeah, but I'm making things easier with passion to educate people.
Right. So, two things that I've noted from that very powerful introduction you've done there is there are two things that patients who get these non-communicable diseases or any other have to go through. It is the cost and suffering, right?
Yes.
So how does early diagnosis and this kind of preventive education on personal lifestyle adjustment help in reducing the cost and suffering that people will eventually have to go through if they get this kind of diseases?
Thank you for the question. Okay, I'll repeat my saying as they do say, prevention is better than cure.
Right.
Now, early diagnosis in any disease is very, very much important. You realize that when I'm talking about non-communicable diseases, these are the diseases that don't attack people acutely. When I say acutely, it means with sudden onset. Talk of diabetes, talk of cardiovascular diseases like hypertension, that is elevated blood pressure, and also talk about cancers. Prostate cancer in men, cervical and breast cancer in women, and talk about chronic respiratory diseases or conditions like asthma. These are the things that they will not attack you suddenly. They will progress bit by bit. And what people don't realize is that for you now to exhibit those signs and symptoms, it will have actually taken you time. And there's about 26% of Kenyans, they don't know about their high blood pressure status. The other day, I think it was last week, I was giving a lecture on high blood pressure. I think if you go through my Facebook page, you'll see those videos. And I highlighted that around 26% of Kenyans, they do not know their high blood pressure status. Now, someone will wait until signs and symptoms start showing up, is when now he goes or she goes to clinic or hospital to get tested. Now, when it reaches at that point, just know that that thing has developed over time in your body, and perhaps now has reached to an extent where it has perhaps suppressed your immune system. So early diagnosis is coming in to help people prevent those causes. Because you look at these non-communicable diseases, even though there are no treatment, because there's no treatment for cancer, it's just management. There's no treatment, the right treatment for diabetes. We can say that absolute treatment like malaria, how it is done. No, it is just management. So the earlier you can diagnose or you can get diagnosed of these diseases, the better they can be managed.
Before I get scared of that suffering in the course, after eventually maybe having gone to hospital and realizing, I should have recognized this early. How should I, what should I do early to ensure that there's that early diagnosis and prevention way before I get, told that now you have diabetes, you have hypertension?
Now, you will realize that there's something funny about these NCDs, the non-communicable diseases. And that's why I came up with a program this year that is called AFIA NCD. NCD is non-communicable diseases. So it is AFIA NCD series. It's a series of videos and pictures and information to tell people how you can actually prevent this before it happens. Now, you realize that these 4 principal non-communicable diseases, they can be prevented. One, or they can be caused. Actually, I should speak first of caused, and now from the caused we can see how we can prevent. So the causes of these things, there are very 4. We have 4 non-communicable diseases, and we also have 4 causes.
All right.
Cause number 1 is alcoholism. Chronic alcoholism, people taking alcohol. And cause number 2, it is smoking. The smoking of cigarettes, the smoking of bang, and so on. Cause number 3 is inactivity, physical inactivity. Like, people are not exercising, they are just there, they are eating, is like they are inputting and not outputting. And then cause number 5 is pathetic diet. We are in era of where people, they don't have time to cook, for example, or they don't have that time to cook natural foods like it was done traditionally. We have these fast moving foods, people just get and eat. So we are having an issue with pathetic diet, physical inactivity, smoking, and alcoholism.
Funny you say that, because there are people who drink, smoke, are inactive, and have a pathetic diet, and that's just one person. So those are very prime candidates for these NCDs.
True.
So from the causes now, how do you prevent this from happening?
So how we prevent these non-communicable diseases from happening, I will be tackling each cause.
Okay.
Now, for example, I'll start by smoking. If you do some research, you realize that one roll of a cigarette has around 4,000 chemicals. And for all those 4,000 chemicals, the chemicals that people know are only 3. That is nicotine, tar, and carbon 2 oxide. Now, nicotine is the chemical part that causes an addiction. And tar is the one that causes the blackening of the lungs.
Right.
And then the carbon monoxide is a very dangerous gas, is a silent killer. You see these people who succumb maybe in rooms with poor ventilation while they have lit their jiko or their stove and so on. They die because our bodies, how we are naturally made, is that our red blood cells have high affinity to carbon 2 oxide, more than even oxygen. So they tend up to take in more carbon 2 oxide than they take oxygen.
Right.
So when considering that fact of smoking, you will realize that once your lungs are blackened, you are very much susceptible to any disease that can affect the lungs. And then by chronic smoking, by each puff you are inhaling carbon monoxide, you are killing your cells. And when you are killing your cells, actually in a long run, you will now be susceptible to any infection that can attack you hematologically. And then, so you find that when we want to deal with issues that maybe affect the lungs, the lower respiratory and the upper respiratory systems, and these lungs are connected. When you look at the cardiovascular system, you realize the lungs is part of it. Now, when you quit smoking, I'm not saying that you quit, you stop right now, but there are strategies that you can use to quit. Yeah, you can use to quit. So when you use those techniques that you can use to quit smoking, actually you will be preventing yourself. Look at alcoholism. Our deputy president, Honorable Rigathi Gachagua, has been leading an iron fight or an iron fist in Mount Kenya region, fighting alcoholism and even the whole Kenya. I looked at Honorable Sankok of Governor for Narok doing the same thing, and Maua in Maragua constituency was doing the same thing, fighting alcoholism. I thank these people because they're doing the right
thing. You're giving
thing.
a thumbs up. You're saying Deputy President
Rigathi is doing good. Wamaua for Maragua is doing good. Sankok for Narok is doing good. Because as far as medical approach is concerned, you realize that chronic alcoholism, first thing, is affecting the community, especially men. You realize that men become less productive. There's crime rates in relation to that, and there's family negligence, like there's negligence of duties, you see. So those are the things that happen. And when you look at the medical perspective, is that when you take alcohol over time, you are susceptible to developing diabetes, which is also a non-communicable disease.
Oh, I didn't know that.
You are also susceptible to getting peptic ulcer disease. Because unajua mtu anakunywa makali and then that thing burns you right from your esophagus down to your stomach and then to your liver. You know, some people take alcohol and they think that it is your liver that goes down. No.
Nasema leo tunaumiza liver.
No. You know, one thing that people should know, that for your liver to get damaged, that is liver cirrhosis, it takes time.
Right.
The first two organs that first of all get injured before they even deliver, first of all is your gullet or your esophagus.
My gullet is this one. That's
yes, your food pipe.
Okay, all right.
Yeah, and then the next thing is your stomach, because you realize that when you are taking those, they are very corrosive. Some of these alcohols are very bitter, they are very corrosive. So they start by corroding the mucosa, that is the lining of your esophagus and then the lining of your stomach. And some people, they take alcohol when they have not eaten anything. Yeah, they take alcohol on an empty stomach. Last week I was there in the morgue for a post-mortem, that is autopsy, and there was a case where someone succumbed because of taking alcohol.
All right.
And you know, right now people are taking what we call binge drinking. Binge drinking is taking more than 3 bottles because you know you want to please your friends, so you want to show how man you are, so you want to take a jug of keg, you know, 5 liters of keg.
Yes. Chafua meza.
So it will lead to, it can lead to what we call hemorrhagic gastroenteritis or something. You know, your stomach bleeds from inside. And when your stomach bleeds or has blood.
That sounds scary.
Yeah. It's actually, you can die.
So that's alcohol.
Yeah, that's alcohol.
Right. We have 2 more.
We have 2 more. I'll talk about pathetic dieting. With the era of people having fast food,
and this is going to be very, it's going to touch a few, you know, here and there. Fast food is quite a thing now.
Yeah, the right people eating to smoky, not smoky is not bad, but to chips,
chicken fry,
chicken fry, and so on. Yeah. You know, most of these things are cooked.
So that's what you're calling the pathetic dieting.
Pathetic dieting.
Right.
You know, first of all, you are supposed to take balanced diet, but people are basing so much on calories. And if they are taking maybe foods, they're taking foods with empty calories. When I say empty calories, means that a food that has it has calories but does not have any nutritive value.
Tell me, I've been seeing this online. Is omena and matumbo one of those? Or are those food that have actually...
Matumbo is nutritious, omena is nutritious.
All right.
Talk of beer. You know, beer is an empty calorie.
Okay.
Yeah. So I'm talking about pathetic diet. Now, one thing that you should know is that in computer science, they say garbage in, garbage out, GIGO. what you take in is actually what will come out. Now, these foods that are they have a lot of calories. Kitu ya kwanza, you need to understand that we have cholesterol. Cholesterol is not bad at all, but we have forms that cholesterol is transported in our body, and that includes high density lipoprotein, low density lipoprotein, and very low density lipoprotein. Of all those three, high density lipoprotein is very good because apart from being transported in your blood, it goes back to the liver for metabolysis. But now you look at the low density lipoprotein and very low density lipoprotein, they stack in the arteries of your heart or your in cardiovascular system. Now when they stack, they make the lumen of your arteries very narrow. And then what happens when your veins, it leads to something we call it atherosclerosis. When atherosclerosis is formed, then it means that your heart has to put in a lot of efforts to pump
that blood can get to every single part of your body.
And now it leads to high blood pressure, what we call hypertension.
Before you move on, there's a question there when I asked about omena and matumbo. Did you say beer or beans as low calories?
I said beer.
Or beer?
Yeah.
Okay.
The beer that people are taking, and then after 5 months they have pot belly. You know, that's just fat.
Okay.
Fat that is for men, fat is deposited in their bellies, especially. Like for ladies, it will be deposited in their butt, their hips, their thighs, their breast, and so on. But in men, especially, it is the belly.
Right.
It is empty. It does not have any nutritive, no vitamin, no something, no protein in it. It is just calories, and they are empty. Yeah. And then
beware of that.
And then the last thing is physical inactivity.
Right.
So physical inactivity, I say it is also a contribution to what we call obesity. Now people are eating, they are inputting, but they are not outputting. Now what becomes?
What do you mean by that?
Is like you are taking in food, apart from you going to toilet and maybe going to urinate, or you are not doing something else to help your body cells actually is then the digestion and so on, and any metabolic process. So what exactly happens is that, for example, you eat a lot of proteins or a lot of fats, and you're not exercising. I've been exercising all over my time because I want my health to be fit. That's why the initiative is here. Now when people exercise, they burn the excess fat. When people exercise, they actually stimulate their heart, you know, because one thing you realize that when you are in a vigorous exercise, your oxygen consumption raises up. So your body for it to accommodate that raising up of the oxygen consumption, then what it means that it has to make your heart pump more blood. Now when it pumps more blood, it clears the cardiovascular system, because you realize that hizo fats ambazo pia zimekuwa zimekwama huko, they will now is washed out, and then you are fit.
All right.
And we realize that these people who eat and then they sit, especially women, sorry to say that, but especially people who they just eat and they don't exercise, are actually susceptible to very many diseases.
Right. We have a question already here from Nefat, and he's asking about that physical inactivity. And nauliza hivi, I am quite a slender guy. Bro, talk to me directly. Don't go through the corners. These are those people who say, I have a friend. I'm asking for a friend. But yeah, Nefat is saying that he's quite a slender guy. Anapenda kukula KFC, na yeye haoni kama atanona. Does he need to be active?
Kuna ile kunona tunayosema iko in genetics.
Okay.
For example, if you're born slender, or if your parents are slender, chances of you getting I can say fat may be very minimal. But that
so the question is whether they are going to be affected by pathetic diet if they continuously eat fried chicken and chips, and they don't think they're being affected. Does it also affect them?
Yes, I'll tell you. Amesema naitwa nani?
Nefat.
So Nefat, what I want to tell you is that you don't have to be fat for this thing to affect you, because when you are eating these foods, as long as there's bad cholesterol. The bad cholesterol that I've quoted is low density lipoprotein and very low density lipoprotein. As long as there's bad cholesterol circulating within your system, you are very much susceptible. And I'll give you another example. We know there's vitamin C and vitamin E. They are antioxidants. Antioxidants, these are the I can say chemical components in food that prevent us from getting some these cancers, these cancers. So if NEFAT continues to eat those things and maybe is not eating balanced diet, no vitamins, you are just eating KFC, those are proteins and carbohydrates. You are not taking a lot of vitamins. Even if you are slender, you can actually develop cancer issues because you're not taking antioxidants. So when we talk about slenderness and being in it doesn't mean that it is actually fat alone.
Okay.
It can be other components as far as nutrition is concerned.
All right. So maybe now we are speaking to someone who's already gone to that. It's already too late for them to do lifestyle adjustment. I don't know, you can correct me if it's ever too late to do any lifestyle adjustment, but this is someone who's now been diagnosed with one of these NCDs, whether it's hypertension or diabetes. What should they do to manage it now? How can they adjust? Should they make other lifestyle adjustments? And I'm guessing this also involves treatment.
For these NCDs, it is never too late until it is late, or until the doctors now can say it is over, or until you breathe your last. But these NCDs, the good thing with them, they are managed. They can be managed, even if they cannot be completely treated, but they can be managed. And I think. So you're asking like if someone is already diagnosed, already has gone to that. First of all, you need to accept that you have it. You know why people or patients are succumbing is that they don't.
Asema mimi siwezi patwa na blood pressure mimi.
Yeah. So when he or she says that mimi siwezi pata high blood pressure, and yet he or she has it, and then ignores whatever precautions are put into to shield more prevalence of it, he or she will succumb. So first of all, accept that you have it. And then the next thing is that I can say the current reading, because we might all be having diabetes, but maybe the stage of your diabetes not like mine. We can all be having hypertension, maybe yours is not like mine. So know where currently you are, your current reading, your average reading. And that's why I tell people that it's better to know your reading. Go for checkup. Go for checkup. Take your blood pressure, take your diabetes. Just be sure that my average readings for this period or for this month or for this year are this way. Now, when you have known that you have diabetes, you have hypertension, what now you should do? I always say that people should have lifestyle adjustment. You know, you've been consuming, for example, and I'll say diabetes and hypertension, they are correlated, and you see that I can say pathetic diet, like taking a lot of sugar, taking a lot of salt, a lot of fat. Those are foods that contribute to elevation of those diseases. So when you can adjust yourself to limiting or taking low sugar, I can say some people, they don't take synthetic. I can say these
processed
sugars. That's the correct term.
Yes, I'm here for you.
So that processed sugar, you know, processed sugar, it is made in factories or in industries, and there's a lot of chemical processes that goes on, you know, because this is just a hydrocarbon. And then so those people, I'll tell them that you do embrace natural sugars. So these synthetic sugars, you're supposed to lower them. Even if you're supposed to use salt, lower it. You see? Even if you're supposed to use fat, lower it. And some people don't use salt at all. They don't use sugar at all, and that is very fine, because if you eat your bread If it has some sweetness in it, that is already a natural sugar, I can say so.
I was going to ask actually, what are natural sugar? Should I be eating mapera? And what are some of those maybe you can recommend?
For example,
where can I get natural sugars? Yeah.
So natural sugars, these mostly are found in fruits and vegetables.
Okay.
Why I say fruits and vegetables is because apart from giving you the natural sugars, they will give you other components to which, when you will have taken the processed sugar, you will not have gotten them.
That's true.
Okay. So for example, if you take a mango, and I'm not saying you take 2 mangoes and so on when you are diabetic, a slice is enough. Yeah, a slice is enough. Like for ladies, they do say that a slice of pineapple gives the gynecologist away, or keeps the gynecologist away.
All right. Yeah, a pineapple a day keeps the gynecologist away. Okay.
So when you are diabetic and you take a slice of maembe, mango, is enough.
Okay.
Is enough.
All right.
Yeah. So, and one thing, if you have those diseases, what you should embrace is physical exercise. During Saturday and Sunday, I see men around here, men and women around here, Thika Road, running from Kahawa maybe to Ruiru, or in between. I do appreciate those men, and I do say that is a good thing what they are doing. So when you embrace physical exercises, you are keeping your body at pace, and actually you are helping yourself. You see, that's what people should be doing.
All right, now into the future, you're a student of medical laboratory sciences, and that's a field that is focused in treatment, diagnosis, and management of these kinds of diseases. First of all, tell us maybe how your studies are applying in this very field, and what are some of the future advancements maybe you see towards treatment and management that people can be looking forward to. When we speak about treatment of, let's say, diabetes, you realize the process is quite painful for the few patients that I've interacted with, what with daily injections, and every time checkup, checking up with the doctor and hospital visits and such. And maybe sometimes, a disease comes out of somewhere and puts you on bed rest for 2 weeks or so, and, recovery period takes some time. Are there ways that this will get easier and better in the future that you have seen so far?
So I would like, first of all, to give a coordination between this FNCD and to the course that I'm taking. First of all, BSc Medical Laboratory in Kenyatta University, we realize that you have to go for annual attachment. That is for your 3rd semester. So for my annual attachment, I've been in level 3, level 4, and level 5. I'll just give an example. Amane Cottage Hospital is in Busia County, Nambale Sub-County, and then Busia County Referral. And I've been interacting with patients because you see, a laboratory officer has to take the readings of the patient because there's a test that deal with diabetes. For example, random blood sugar taken any time in a day, that is called RBS. So whenever a patient sees RBS, that is sugar is going to be tested. And there's also fasting blood sugar, that is FBS. This is taken when you have at least not eaten for around 8 hours. Now, you will realize that when I'm taking the readings of these persons, not all of them have the normal range. Some of them are quite elevated, and some of them, they are, I can say, hyper, or maybe I can say the readings are too high to an extent that even a glucometer cannot actually equate the actual reading. It will just read above 33.3 millimoles per liter. That's a very high reading. Now, you realize even for blood pressure, level 3 and level 2, they do use those books. For example, your patient atapitia kwanza kwa clinical officer, kwanza kwa desk reception, to the clinical officer, now to the lab. So when you look at those readings and you realize this blood pressure is too high, and again you take diabetes is too high, or maybe it is within the normal range, therefore it starts now to open your mind what this person can be going through.
All right.
Now, you realize that again, the intervention that I think I've put through when I was back then in Busia County, I've been having a program that is a Afya Mashinani Health Outreaches Program. It's a program that I started this year, early this year, that is January. And I've been, my home, especially on weekend, it has been always busy. People have, when people know that doctor is around,
they have to come with.
They will prefer to come to your home, and when I'm not around, they will make stories with my mother until I come. Now, when I come, what I liked doing is I give you first health education. I'll tell you the trends, how have you been feeling. Of course, you have to come along with your medical book so that I can look at your medical history. What have you been taking in form of drugs, whatever recommendation you have been given. And I'll give you a health education, and I'll tell you, you have to reduce ABCD, you have to reduce this, and you have to also to increase ABCD. I think those interventions, when they are now put maybe in a larger population, it will be something that will help people. For me to test you blood pressure and blood sugar, in the courtesy of the program, I was doing it for free. But now you see, a patient who lacks, for example, cash, to go to hospital to do that checkups, will feel like sina pesa and that's all. But me, I was helping my people at least to reduce this prevalence of these diseases in my home area. So if that thing is amplified, maybe to the whole Kenya or to the whole county, I think we'll be so much dealing with this afya, we're dealing with non-communicable diseases at a wide
range. You're saying that the biggest win or the biggest way in which you can tackle this is preventive measures. Making sure that you're being checked early and doing lifestyle adjustments as early as possible. And also that's what you are doing in terms of sensitization through Afya Fitness 20, your healthcare initiative. We did tease it a bit earlier. Maybe in a summary of a paragraph or two, you can tell us what kind of activities are happening at Afya Fitness 20 Healthcare Initiative, and what is it that maybe someone out there can look forward to if they reach out to you through this program.
Okay. Afya Fitness 20 Healthcare Initiative is dedicated in promoting healthcare access to especially the vulnerable, the school children, and the community. You realize that Constitution of Kenya, Article 43, they say that a citizen has a right to attain the highest healthcare, the highest standard of healthcare service. You see, and you realize that Kenya is having universal health coverage, and also is aiming at attaining the standard development goal number 3, which is health and well-being. That is according to the vision 2030. So looking at those factors, I want to help, and by the time by me helping, I'm still a student, I don't have that financial muscle to do a lot of activities. So the best I can do is to, as long as you have your phone, or as long as I can reach to you, I'll tell you about what you're supposed to do. And while I was in Busia County, I was working to schools. You see, I was working to schools and advising the students and the pupils on matters to deal with health.
Are you doing this alone, or do you have a team with you?
Okay, I have a team.
Okay.
I have a team. So, but the team is coming in after I have formed it.
All right.
Yeah.
Sure.
And when I came to here to Kenyatta University, during the menstruation health hygiene, that was 26th of May, I went to Gladys Girls High School, that is in Githurai 44, and I worked with my team of medical students that are doing medicine and surgery, and we went there and sensitized girls on menstruation, health, and hygiene, and even donated some pads to them. It was actually a very good event. Now, you realize that this, when I talk about vulnerable, I'm not meaning that people maybe who are or what vulnerable can mean. Vulnerability in my context is people who may not have the chance to get a health information as to the others. And this includes people maybe in the school children. You know, school children are just playing, they don't know what is happening around the ecosystem. So I help them understand what is supposed to be done. And I'm not dealing with precisely health alone, because you realize at Fitness 20 I'm dealing with 3 things, that is health, lifestyle, and mental health, mental wellness or mental health.
All right.
So for the health part, because I'm aspiring or I'm to be a medic or a medical professional, so I really want to help my people. You know, they have educated me, so I want to give it back.
Also educate them. Right. That's a very good way to put it there. They educated you, and now you're educating them.
I'm educating them.
Right.
So you realize that I've been doing this for now 3 years since COVID-19, and it has been a lot of challenges. You know, at one point I felt like I should give up because it was not bringing any money. But until I fought that idea, actually, that you know, money should not be a first priority when you are setting up your idea or when you are setting up something that has a long-term goal. So I put money aside, and what I put in front is the healthcare priority of the people, and that's what I've been doing as of now.
All right, very commendable job there of your Fitness 20 Healthcare Initiative. And now we are going to have a discussion here this morning with a reverend, and this is going to be on men's mental health. This is a month where, you know, mental health of men is taken a look at, and, you know, awareness is spread. A few days ago, it was Father's Day. In November, it is there's a day for World's Men Day, I think Men's International Day, and that is also a month to ensure that we are also sensitizing men's mental health. So these 2 months are really important. Now, for Afya Fitness 20 Healthcare Initiative, I see you are also focusing, as you said, the third pillar being mental health. And we're speaking to business people, right? We're speaking to young people who are trying to get jobs. We're speaking to young people who are going to work, who are starting out in life, mostly on this Biashara Tuesday show. Adjusting their lifestyle, I think, is really important, and I'm hoping that everyone who's been watching the show has taken a few notes here and there. They've seen that it's we need a future generation to raise revenue and to run the country and to pay taxes, and, you know, to have future leaders as well. Mental health, how does it come in Afya Fitness, and you know, in what areas have you been focusing so far, and what can you inform us about the status of mental health amongst men?
Yeah, I'll start by saying I like what the former president of Kenya, that is Uhuru Muigai Kenyatta, said on 56th Madaraka Day, that was 2019 in Narok. So he said that depression has become a normal thing, it has become like a day-to-day issue. And he was saying that the employers, you know, the employers should actually take or invest more in their workers or in their employees, and he directed the Ministry of Health in conjunction with the county governments and the Ministry of Education, Ministry of Youth and Gender Affairs to look into that issue. That was 2019. So in 2020, the report came out. You know, the report came out of this mental health, and actually it suggested that mental ill health, you know, is a national disaster, or I can say national disaster in emergency, in public health emergency. And also you realize that the report that was given by WHO in 2017, it shows that Kenya is 5th country in Africa recording highest number of depression and suicides. You know, depression is just related to suicides.
That's a very sad state and position we find ourselves in.
You look at the mental health action plan that was released now in 2021, actually confirms and says that it is not only depression but also drug and substance abuse. So you realize that mental health, first of all, if you see that person being in mental health, there must be something that has led him or her to do that. And for you to deal with the message, you first of all have to understand the messenger and the message. You see? Yeah. So After Fitness 20 Healthcare as an initiative is actually championing for people to have that mental health stability, because it is fitness when you're actually mental fit. I like what Rashid Aman said, the former health CS, said health without mental health is nothing. You see, actually, when you look at the 4 pillars of well-being, that is health, we have physical health, mental health, we have spiritual, and then we have I just forgot, but there are 4. So in those pillars of well-being, when you lack mental health, you have lost everything. Even if you own billions and billions of money, but your mental health is compromised, it means nothing.
Right.
So that's what After Fitness is coming in, to champion people to talk about or to speak out. You know, I've been going to schools and I've been advising students and people, speak out. You know what is happening? These children could be going through gender-based violences, or rape, even defilement. And then the perpetrator said that when you try to raise your mouth about this issue, I will kill you.
It's going to be worse. So
that kid, you know, stays, it eats down, and then what happens? Maybe he or she can commit suicide. But I say, you come out and speak. Constitution protects you. Because Constitution in a Sexual Act 206, it actually outlines what's supposed to be done. Na ndio maana mimi kama as a medical lab profession to be, you know, people, especially ladies who have been defiled and who have been raped, the first thing, they are supposed to be taken to hospital. You know, reporting to police can come later, but first of all, deal with the medical issue. And they come to the lab, we will collect their samples for certain types of tests, and that includes hepatitis, HIV. We also do swab to see if they're actually the guy or ejaculated, or to help minimize the risks of pregnancy. Now, when they come to the lab, we are the guys that will help this person, because when I give a wrong report, this girl will not be helped. But when I give a correct report, this girl. So I tell them, first of all, seek medical help, because Constitution, that Act, Sexual Act 206, says that you are not supposed to pay even a cent when you have been defiled or raped. It is actually free in any public. So perhaps to someone who doesn't know about that information, I'm telling you to know, if you are raped or if you are defiled, the first thing you're supposed to do, seek medical attention. Go the way you are. Do not take off your clothes, or do not wash your hands, or do not take shower. Go the way you are. And the Constitution protects you, and no public hospital or facility will charge you even a single cent. And the good thing, you'll be given a post-exposure prophylaxis for HIV. It is actually free.
All right. Yeah. That's a good provision there by the Constitution, but I'm hoping that that is the actual situation on the ground. Knowing how, you know, most of our public institutions are known to be, I'm hoping that, you know, victims actually are getting the same help on the ground as they're getting it on paper in the Constitution. But to wrap it up, Isaac, I think we've had a very informative discussion, even from the comments that we're receiving here so far. Let me just, I can take a look at those later and get to see what people are saying as they come in on KUTV. I see there is Like It. Interesting that they're called Like It. Watching from Nairobi, this is a very sensitive topic. Good job, Isaac Ogutu. It's sensitive, but it's important for us to break it down here for everyone to be aware of mental health, physical health, and also, you know, lifestyle adjustments to ensure that some of these non-communicable diseases, which have been the main conversation for us this morning with Isaac, are prevented. The people of God are watching from Nairobi. I want to know if the people of God is one person or those are several people, but thank you for tuning in, the people of God. When we are speaking about mental health, maybe just to wrap it up and tie it down with the rest of these lifestyle diseases, non-communicable diseases that we've mentioned, like hypertension and diabetes. When you're in a very stressful situation, how does this affect maybe your cardiovascular activity? Is there a way that mental health, I know earlier you mentioned smoking, drinking, pathetic dieting, and physical inactivity. does mental strain also lead to some of these NCTs?
Yeah, there's a relation actually is very much evident. For example, you realize that when you are stressed, you don't take food. Actually, most people, they don't take food. A small population will overeat, but a very good population will just say...
and sometimes if they overeat, it's junk food still.
Yes, exactly. So if someone overeats because of stress, you know, it is junky food that you're taking in. It will actually lead to a certain... And if you are not taking food, you know, some people, they tell themselves, oh, Nikona stress, I can now take alcohol, I think bangi, it, and it will ease, and so on. But now you are taking alcohol on an empty stomach, you see? So what it will now lead to you, that is an empty calorie that you are taking in your body. And apart from injuring your esophagus and your stomach, you know, alcohol constricts the blood vessel. Constriction means if this is your blood vessel, alcohol will make it shrink. Mona. When it makes that shrink, it means that your heart needs to pump blood with a lot of pressure in order maybe to accommodate that stimulus. And then you realize that over time you will start developing hypertension. And you realize that if we say stress, we are not meaning that the situation where you are thinking a lot. We realize that stress is a stimulus, a stimuli, something that is provoking you to do something, to think, to act, or to feel something. Thinking part of it is cognitive, feeling part of it is kind of emotion, and acting part of it is physical. Because what you might be going through is subjective. You know, you can be actually okay, but inside you are not
really
okay. I can see you are okay, but inside you are not okay. So it is subjective. So when you realize that stress and all these things, at the end of the day, they can actually lead you to non-communicable diseases.
Thank you so much, Isaac. This has been a very educative conversation, and I've enjoyed it myself. I'm hoping that everyone who's watching at home has actually enjoyed that as well. And this has been a conversation on NCDs, and we are trying to ensure that non-communicable diseases are not something that you're grappling with the current health situation in the Republic. It is important you stay away from hospitals if you can, as much as possible. That has been Isaac Oguta, and I think he just grabbed something here for me to have a look at. I'd love to know. You can tell us what this is.
This is my T-shirt. I think this is my second T-shirt. The guy who brands it for me is called Chris, CEO Brandvic. It's just here at Kenyatta Market. Yeah, if you want connection for branding, I can actually link you. He has been printing my T-shirt since 2021, and this is my actual T-shirt. And even I have a banner of which I just forgot to carry it. So I do this T-shirt for promotion, you see. When I sensitize people to things to do with health and mental health and lifestyle, actually when someone can see this is a fitness. And you see, this is the back and this is the front. So this back, it is written the #1 healthcare service provider.
And the website there, so people can be checking that out, afterfitness20.com.
The website and our social media handles. So when you cannot receive that healthcare service maybe in a hospital, we are here for you.
All right.
You know, hospitals, because first of all, you realize that when you look at this logo, I'm dealing about with quality, affordable, and trusted
healthcare.
Affordability comes with cost. If you cannot afford, we can actually help you. I'm looking to be in that position where I can help you. And we're also dealing with quality. You know, when you don't have money and you are sick, and comparing to someone who has money and he's sick, I think the guy with money will be given the first priority.
Quality,
and then trusted. I'm a medical profession. In the next
University.
coming months, I'll have graduated. So by that time, it will now be a trusted because you are actually dealing with a health expert who understands what is going on.
After Fitness 20, Isaac Ogutu, thank you very much for joining us here this morning. Biashara Tuesday takes a short break. I'll be sampling on Twitter on the hashtag Biashara Tuesday at KUTV Kenya and also at Richard_Kenya. Where can people get this t-shirts, or these are just for the patients that you will be taking care of?
I think I'm rolling out a strategy in maybe next month. I've sold a number of them. Yeah, but the stock is I think limited. Next month I'll produce another batch. Of which I'll be giving out.
Keep tabs on their social media handles and you'll get more information. We'll be right back after this.